Hi my beauties, I wanted to do a video focused on lower face rejuvenation. This is an area that's probably the most requested when I see patients in my clinic every day.
Hold me close till I get up. Time is barely on our side. I don't want to waste what's left.
Whether you're 30, 40, 50, 70, there's different changes that happen at each age, and with each individual patient in craniofacial anatomy, understanding the changes that are personally happening in your aging journey is really important to determine what treatment option may be best for you. It's always important to understand the changes that happen with age. Our faces are constantly changing from the age of 20 and beyond. Aging isn't a bad thing, it's a blessing to gain a year of life and to live a long, healthy life, but there's things that we can do to kind of offset the changes that happen as we get older. Some of the changes that happen, and this is what I talk about with my patients when I see them in the office, is we have thinning of our skin. So our epidermis and our dermis thin over time, and that's just one of many changes that happen. We have fat atrophy. Our fat pads will decrease in size, they thin out and they separate. That's why we start to get things like tear troughs or nasolabial folds or marionette lines or festoons. You'll see different contours of your face changing as those fat pads thin and separate. There's also bone resorption that happens in your 40s and your 50s, and depending on when your pre and perimenopausal and postmenopausal periods are, the bone resorption is a real thing that happens and takes place. So as we get resorption of our bone and our jawbone becomes less defined and less thick and it gets thinner, you have less structural support under your skin holding up that lower face. That can manifest with changes in our skin, which we see jowls, lower face laxity, a less than defined jawline, or kind of the mono unit where your face blends into your neck without that delineation of that jawline separating those two cosmetic subunits. That happens because we get bone resorption. So things, for example, like doing a little bit of filler to add in that structural support and replace the bone that's been lost will help not only rejuvenate and help lift up on the jowls, but will help give that structural support and that beautiful contour and delineation that you once had. So understanding the changes that are occurring with you personally and just in general the changes that our face encounters as we age is really important when you're talking about lower face rejuvenation. I just got home from work. Don't judge me by my hair. I just did Botox on my neck. So where I did it, I did a little bit, about 10 units under my submental area here, because I love that it like tucks that in, and on profile it just kind of like helps that little piece of skin just kind of be tucked in. I also did little micro droplets of Botox in my neck, and patients always ask to this. It doesn't affect like my workouts. I do Pilates and core strength training with my trainer. It never like inhibits my neck muscles, but it just really helps smooth that area out. So disclaimer, I have done thread lifts in my neck, I've done thermage, I've done Fraxel. I actually just did picotoning really recently because I get melasma on my neck too, so I do that. But Botox is a really great way to just kind of help soften and help with like neck laxity. Other indications for Botox is the Nefertiti lift that goes along the jawline. We usually do 10 units per side, and the way that that works is the muscles in the face and neck are antagonistic, protagonistic on one another. They're always pulling and pushing on one another. So when you soften the muscles that pull down, the resting tone of the muscles that pull up define and delineate that jawline. Other things that we can do for platysmal bands, which go this way, when people have really like bandy necks, we can do Botox, usually like 10 units per band, to kind of help soften that and make that not so like apparent. And then other things that we can do with Botox, tech necklines or horizontal neck bands, which can sometimes happen with age or be accentuated with age, but also just happens like anatomically. So you can do about 10 units in the neck bands too. So there's lots of different things that we can do for lower face rejuvenation in neck with neuromodulators. Also, I use a 33 gauge needle. This is the smallest needle available on the market. It's a 33 gauge needle, and it makes the Botox injection experience much more pleasant for the patient. It's a little bit more expensive, so it's more overhead, so a lot of offices don't want to pay the extra money, and instead they use 30 gauge needles, which are bigger. So when you talk about the size of a needle, the lower the number, the bigger the needle. So a 30 gauge needle is bigger than a 33 gauge needle, so it hurts more. So I always want patient comfort to be a priority in my office. It takes more money and it's a little bit more expensive, but the experience is much better for the patient. Less bruising, less discomfort, and it is more expensive, so not a lot of offices like to spend the money. But after injecting for 15 years, I've actually never not injected using a 33 gauge needle. So lower face rejuvenation. So a lot of people ask, and I'm just going to be looking at the camera so I know I'm distributing my skincare products evenly. I love this glow that the vitamin C gives. I struggle with melasma, so it's like the only product that's a non-hydroquinone, and besides lasers, that help keep my melasma at bay. Okay, so with lower face rejuvenation, we're talking about tightening devices. You have soft wave, you have Ultherapy, you have Thermi, you have Thermatite. There's so many different forms of it, but basically these energy-based devices put heat in the form of radio frequency into the skin to lift, tighten, and pull, and it's really useful for like lower face laxity, and that's probably out of all my patients the most commonly requested area to treat is lower face for tightening. So when the energy goes into the skin, it stimulates the fibroblasts, which are the collagen producing cells, to make collagen, and that helps lift, tighten, and pull, especially like on this area. So when we do treatments, you can do full face, or you can do neck, or you can do full face and neck, but when you concentrate all those pulses in the tip, because for example, a lot of these energy-based devices come with a tip with a certain finite number of pulses that it administers to the skin, like a Thermage tip will have 900 pulses. You can put those 900 pulses over the whole head, face and neck, head to toe, but when you concentrate it in the areas that you're trying to really focus on, it just packs a punch and just gives a better result. So usually we'll focus it from like the mid face to the upper neck, because you're just snatching and pulling and lifting and tightening that area. So with respect to the different forms of energy, a lot of people will say, well, which better, soft wave or Thermage, or Ultherapy or Thermage, or Thermatite, which one's better? And the answer is, we're all a product of our experiences. I've had the best luck with Thermage because I worked in, several offices where we had both devices, and consistently people are more happy with the results from Thermage. Now, again, that's very operator dependent. If you have a great, operator who's really pushing the limits of a Thermage with maximal safety and maximal efficacy, and then you have someone who's not doing the Ultherapy correctly, it's, of course the Thermage is going to look better. But in my case, we had 10 dermatologists, plastic surgeons, and RNs who are laser specialists and energy device specialists doing these procedures, and still consistently people were always more pleased with the results from the Thermage overall therapy. And soft wave is kind of the same mechanism of action of all therapy. It's ultrasound, which is the energy form that goes into the skin that heats up the skin and stimulates collagen. So out of all the tiny devices, I personally like Thermage. Happiest patients, you only need one treatment. When done correctly, does not melt fat, does not have any side effects. There's always a result. It's never like the patient comes in and is like, I don't know if I see the difference. But I see patients say that a lot with all therapy. Even if the operator is completely doing a correct treatment, they'll say, I'm not really sure. I'm a little underwhelmed with the results. Where people who have Thermage are like, damn, I love this. Look at my before and afters. I'm stoked. I'm already seeing results. They're consistently more happy. So I like a Thermage. Again, I'm not sponsored by any of these companies. I just base my choice of laser or energy-based device or treatment based on what I see in real life with people having beautiful results. So that's why I really like Thermage over Ultherapy. But that's not to say Ultherapy or soft wave aren't great tightening devices. I mean, to each his own. If you've had a great experience with Thermage or Ultherapy, please drop a comment in the comment section, and you guys should share your information and your experiences, because this is me telling you guys my experience and what I think is best, but that may not fit with what your experience is. Sorry, where's my neck tape? Energy-based devices, the way they work is they stimulate collagen by putting heat into the skin. Now, Ultherapy uses microfocus ultrasound. Thermage uses radio frequency. You can have monopolar radio frequency, bipolar radio frequency, but at the end of the day, skin responds to heat by stimulating collagen. And when you have more collagen in your skin, it lifts, it tightens, it pulls, it tightens out the contour, it lifts the saggy jowls and the laxity. So for lower face, energy-based devices are like my favorite treatment. We now have Ellacor, which is microporing technology. I actually participated in the clinical trials for Ultherapy, and for Ellacor, and we were really, you know, impressed with the results that we got back in 2018 or 19. And now that the device is available to everyone, I actually have an Ellacor, and I do it quite frequently in my office with great results. But what I found is that Ultherapy, why do I keep saying Ultherapy? I don't even have an Ultherapy. I'm not even like an Ultherapy fan. But Ellacor results are usually better with more mature skin with more laxity. So if you're, you know, 70 years old, you've never had anything done, and you have, you know, non-dynamic rhytids in the lower face, and when you like bend forward, you get the kind of crinkling here. That's usually a patient who would be a better candidate for. I don't even have my mic on. Okay, you guys, well, I'm not going to redo this. Let's just go with it. That's a patient who would be a better candidate for Ellacor. So Ellacor does better on more mature skin, thinner skin, more laxity and wrinkles. Thermage is better for people who just like the people who come in, they're like, doctor, I just need a little of this. Like, can you do just a little of this? Not like a lot, but just like a little bit, just to tighten that up right there. Those are the people that do well with Thermage. And younger patients who actually don't even have any laxity yet actually do really well with Thermage because they're collagen banking. And what collagen banking means is that you're increasing your skin's collagen density. So as you lose 10% of collagen each decade, which is a sad truth, it happens, it starts actually in our 20s, increasing your collagen stores. So over the decades, as you lose collagen, you're kind of like staying in the same place. So collagen banking just is kind of like staying ahead of the game and increasing your collagen stores, so as you lose your 10% of collagen each decade, you're staying in the same place. And that to me is the true meaning of anti-aging. That's without surgery, without a scalpel, without having to go under, and you're basically inducing your body's own regenerative processes to act and behave younger. Histologically under the microscope, your skin has more collagen, and clinically what that translates to is tighter, smoother, firmer skin. So in your 30s, when you start to notice this stuff going on, and in your 40s it gets worse, and in your 50s you usually need a facelift, it kind of just keeps things in check. I've done Thermage on my lower face like 4 times in my life. When I was 30, 35, 40, and 45, and I'm like really, really glad I did. I kind of fell off the wagon when my kids were really small, but it was a hard time in my life when I was hustling and working and spending all my time treating patients and not enough time on myself. But now that my kids are older, they're 9 and 13, and I'm in a better place in my career and my life, now I can do all these lasers and tightening devices on myself all the time. Okay, so the kids are gone, and Jess and I are going to go out to breakfast and do some Christmas shopping today, like last minute Christmas shopping. But I wanted to do this vlog for you guys, and I like hanging out with you. I feel like I'm just chit-chatting with my friends about aesthetics, which is amazing. Okay, I just washed the front of my bangs. You guys ever do that? I don't have time to do my full hair routine, so I washed the front. People talking about neck lifts all the time, and I'm not gonna lie, I probably am gonna need a neck lift like soon. See, it's better when I do this. But I mean, it's better than it used to be, but you know, I would love for it to be like that all the time. But I'm not a candidate yet for a neck lift, but when I am, I'll be the first in the OR to get it because I just knew a little bit of that. But energy-based devices and lasers and threadlifts can do a lot because, you know, people always ask me what I've done in my videos from the past when I was actually in my 30s, and I'm in my 40s now, and that's all I've done. But believe me, when I get a neck lift, you'll be able to see it, and I can't wait for that to happen. Just nobody will operate on me yet because it's not like severe enough to qualify me for a neck lift. Let's talk about threads. I don't know if I can do this in the mirror. So let's talk about threads. So thread lifts are a great way to lift, tighten, and pull the lower face laxity without having to have surgery. And we used to think that thread lifts lasted a lot longer than they do, though. We're finding out that like thread lifts now last about 6 months to a year, which is actually not that long. I wish they lasted longer, but when they were first launched, you know, I think they first fell into vogue like in 2014, everybody was saying, oh, it's gonna last like 2 to 3 years. But for the right candidate, I think thread lifts are a great option, especially people who don't, you know, say they don't want to do a filler, or they don't want to do any injectables, including Botox, or, you know, they're just trying to put off the need for a lower face and neck lift, and they're not bothered by the fact that, you know, the threads may not last longer than, you know, 6 to 12 months. I think that, you know, thread lifts are a great option. It's just they don't last as long, and if you have someone who doesn't know what they're doing, they could be bad. And back in the day when I was just a baby, in medical school doing thread lifts and procedures on patients who are much older than me, who are actually my age now. There were a lot of different types of thread lifts that were used. So there was ones called Insta-Lift, which were like a suture on either side, and you'd actually pull it. You'd use a cannula and you pull it through and through, and then you would tighten, and then somebody would cut the ends of the suture. And then Mint was like a Korean-based, I think, thread lift company that had really great results, and they had like newer technology. So then I adopted that. And now I feel like PDO Threads, it was PDO, then Mint, and now PDO again. And I use PDO in my office. I think PDO Threads are the best because it's made out of polylactic acid, which is the same biostimulatory filler that Sculptra is made out of. So not only does it lift mechanically, but it also gives a biostimulatory effect to induce collagen synthesis and extracellular matrix protein synthesis, which basically adds volume. So not only do the PDO Threads lift mechanically, but they add a fullness and add a really youthful looking volume to the face. There's some lidocaine, and you basically, for a lower face tightening, you'll insert usually 3 sutures per side, so 6 in total. If you want to do the neck, it's usually 2 or 3, and you can actually do it under the submentum too. And when it comes in from either side, it basically just snatches that area. And so what happens is you make a little incision, not an incision, but basically you use like an 18 gauge needle, and you basically tunnel it through. So there's no like scalpel, like incision or like surgery or stitches that are outside the skin. There shouldn't be any scarring. It just basically gets cannulated through the skin, and you put 3 of the threads through, and then you basically, tie 2 together. So through each portal there's 2 threads, and then you kind of twist them on each other and you pull. And as you tighten the sutures, you see the skin like actually get stretched up, which is really gratifying when you're doing it as a surgeon. So then you just cut the sutures, and then there's no evidence of the threads being in there. You can't see the sutures under the skin. Even when people smile, you shouldn't be able to see it at all. And I think it's a really great option, because not only does it lift, tighten, and pull, but it stimulates your body's own regenerative processes, which is always a good thing. Anytime you can induce your body's own regenerative processes and induce your skin to do the work and make the collagen, results are just better. They're more natural looking. Oh no, babe, am I taking too long? Come in.
Oh no, I'm on the phone. I was just bringing it back.
Oh. Hair stuff.
Yeah. She's doing a video, of course.
And then we're going to go Christmas shopping. Okay, I think I'm pretty much done. So we've talked about energy-based devices. We've talked about thread lifts. We've talked about Botox. We've talked about lots of different things. But what we haven't talked about is filler. So I feel like some of the old school ways of rejuvenating the lower face is just doing like way too much filler. And that's like the wrong thing to do. Babe, I'm almost done, I promise. And I feel like it just depends on the filler. So if you're gonna do like a biostimulatory filler like Sculptra to put it in the mid-face and lift, tighten, and pull, I think that's a much better option than doing hyaluronic acid fillers, where people are like getting so full and distorted because people are giving way too much filler way too fast. And I feel like it's a much better look. It's a much better look. I feel like the biggest mistake you guys can do is by putting so much hyaluronic acid filler in your face that you're using the HA filler to lift the lower face laxity. That's like kiss of death. Like that's something you never want to do. Sculptra biostimulatory fillers are different. If you want to do Sculptra in the mid face to naturally lift, because you're inducing your skin to make collagen, elastin, and hyaluronic acid that's going to add volume to lift, that's one thing. But if you're just doing a bunch of filler and filler and filler, that's HA filler like Restylane, Velour, Volux, Vobella, Voluma, RHA2, RHA3, Radiesse. You don't want to use, well, I guess Radiesse is a biostimulatory filler, but I don't like it in the mid-face for other reasons. I could do a whole other video on that. But you never want to use HA fillers to lift the face. You want to use biostimulatory fillers to naturally induce volume, which is going to lift and pull. The only caveat is jawline filler, and I love Volux for the jawline because it was engineered specifically for that. It was launched by Allergan 2 years ago, and it's a really beautiful jawline filler. And when I put it, I use a cannula. When I put it in the angle of the jaw right here, it literally like lifts and will help with the pre-gel sulcus, with these little jelly, saggy, laxity areas in the lower face. So Volux here will lift with beautiful natural looking results. That's different than putting HA filler in your marionette lines and in your nasolabial folds and in your mid face, to where, yeah, you're lifting up on that, but then you look like this puffer fish face, pillow face, like the epidemic that we've been seeing over the last couple of years. So a lot of other people talk about, you know, at-home devices and like things that they can do at home for lower face tightening. Now, of course, just like non-surgical options are never going to be as impressive as a surgical result, at-home devices and treatments aren't going to be as profound with respect to the results as in-office treatments, but they can do a lot of good. So things like Gua Sha, face yoga, facial massage, facials, things like that that are a little bit, you know, lower tiered, can actually do a lot as well. Now, I'm not going to lie and say that, you know, doing Gua Sha is going to give you a facelift result. That's just ridiculous. That's not going to happen, but it can make a difference. And I think lymphatic drainage has gained a lot of popularity and is a legit thing that one can do at home to help with having less prominent jowls or lower face, you know, lower face laxity. It's not going to tighten the skin, but it's going to mobilize the lymphatic fluid, which is going to give the lower face like a sharper and more defined look. But I always have to be careful what I say, because it just depends on your age, your degree of laxity, and how much, you know, fluid you have in your face. If you're a 23-year-old who went out the night before and you woke up and your face is a little bit puffy, Gua Sha is going to make a huge improvement on your skin. If you're 70 years old and you probably are a facelift candidate and you do Gua Sha, you're not going to have the results that a facelift is going to give you. So it just depends. So I have to be careful what I say, because people in the comments are going to say, you say Gua Sha didn't, you know, work, or you say Gua Sha is going to fix all my problems. And it really, like with anything in medicine, it's a case-by-case basis. Every patient is different. Everybody's lymphatic volume status is different. Everybody's degree of facial laxity is different. So it's not like a one-size-fits-all situation. But Gua Sha, eating clean, drinking lots of water, not sleeping on your face. For some people, facial yoga, yes, I think that maybe that could be beneficial, but you have to, you know, be careful with facial yoga, because you don't want to start, you know, you don't want to cause creases and folds in your face either. You know, you always want to like minimize muscular contractions and immobilization of the facial muscles, which is why Botox works so well. So just keep that in mind. Also, people have to remember that this is, you know, my industry, this is my career, and it's not something that I just started doing like 10 years ago or like 5 years ago. I've been into this stuff since like before it was a thing, like in the early 2000s. So I had a patient yesterday that says like, you know, you're so good at injections, and like it's just different when I go to you than other people. And I'm just saying this because you have to remember, I've been doing this for almost 20 years, like before my time. Like when I was a medical student, you know, 23, 24 years old, I remember, so medical school is 4 years. In the first 2 years, you're in the lecture hall. In the last 2 years, you're on rotations in the hospital, doing your clinical rotations through like surgery, OBGYN, peds, psych, primary care, internal medicine, all those different specialties. But your first 2 years, you're in the lecture hall. And I used to leave the lecture hall when I was just a baby, and I would go shadow the derm residents, and I would ask them to let me do lasers and inject patients. And as a, you know, medical student, I was chaperoned by, you know, the third and fourth years, and then, you know, the attending. And I was injecting Botox since I was just a baby myself. So now at 46, after being in practice for 15 years doing this, you know, I've learned tricks along the way. I've seen it all. I've used it all. I've participated in clinical trials. So, and sometimes things aren't successful, and then they get repackaged and rebranded as something else. And if it didn't work 5 years ago, usually it doesn't work now, even though there's like a different marketing company that's taken over, or a different PR firm that's, you know, has taken over some companies and things like that. So just keep that in mind. I've been in the industry a long time. And then also people say in the comments like, that's a full-time job, she's done so much, she has access to every laser and every energy-based device, every injectable. Well, yeah, that's true, but it's my career. I don't focus my life around it. I do these videos for you guys for educational content so that you can make informed decisions on what treatments you get yourselves. But yeah, of course I have access to everything, and this is what I do all day, like as for my profession. So that's like going up to a personal trainer and saying, that's not fair, you get to go to the gym 6 days a week. Well, yeah, they're a personal trainer, that's what they're gonna do, like, duh. So just keep that in mind. It is my life, but it's not like my life, like it's my job and it's my career, and half the time I'm experimenting on myself before I give you guys treatments. Okay, now we're ready to do some Christmas shopping. I always hold my breath.
And on we'll go, through the wastelands, through the highways, till my shadow turns to sun rays. And on we'll go, through the wastelands, through the highways.
So we're going to Parakeet, which is one of our favorite places in Newport, and it's a beautiful day. My boys, and they're dog friendly. What are you gonna get, boo? They don't have gluten free.
Blueberry snow.
Is that a doggy treat?
Chocolate chip cookie.
Hi, Bubba. What are you gonna get? So Justin's super stoked to have gluten free. I'm obsessed with these green juices. Look at.
Yeah, can we get the?
I'm gonna get this one: kale, spinach, cucumber, celery, pineapple. Yes. Salud.
Salud.
The hell? What's in that?
Apple cider vinegar, lemon, ginger, and turmeric.
Nice. Avocado toast with salmon, the green juice, my boy, my dog. Okay, so for also talking about lower face rejuvenation, eating healthy and having a clean diet makes a huge difference just on your overall health, skin laxity, elasticity. I love this G5 cold pressed juice that has kale, spinach, cucumber, celery, pineapple, lemon, ginger, and turmeric. It's a go-to, and it is very important, right, babe? So doing a little shopping at Fashion Island. So I wanted to do a quick post and talk about Ellacor. So we haven't talked about Ellacor much in this video. Also, it's like really sunny outside. So I have Justin's sunglasses. I forgot mine at home. So Ellacor is a micro-coring technology that is used for skin tightening. Now this is different than Thermage or Ultherapy or soft wave or energy-based devices that use heat to put, heat into the skin to stimulate the fibroblasts, which are the collagen-producing cells to tighten the skin. Instead, what micro-coring or Ellacor does is there's no dissipation of heat, there's no energy, there's no radio frequency or microfocus ultrasound. It's basically just taking little pinpoint pores of skin out to shrink wrap the skin. So we call it shrink wrapping the skin because you're taking about 10% of the skin out in a scarless fashion. So there's no heat stimulating collagen to lift and tighten. It's basically just tightening by taking, almost like making the skin into Swiss cheese, taking out these little microcores and just reducing the surface area of the skin. So we call it, skin removal in a scarless fashion because the tiny little microcores don't leave any scar, but you do get this tightening effect. In my experience, I feel that people do better with Ellacor if they have more laxity, if they have thinner skin, if they have a lot of gathering of the jowls, if they're the kind of patient that's doing this, Dr. Capel, I want this, Dr. Capel, can you do this to me? Those are the good Ellacor patients. Now, how do I decide between a patient who needs Thermage versus Ellacor? The way I do that is if their skin is really, really thin and they have a lot of gathering here in the jowl area, usually they're more an Ellacor candidate. If they don't have that much crinkling of their skin, but it's more just kind of a ill-defined jawline that they find as sagging, usually Thermage is more the way to go because Thermage has a different mechanism of action than Ellacor does. Ellacor, just removing skin. No energy, no stimulation of collagen, nothing like that. Just removing skin to make the skin tighter, kind of like a facelift would be. but just of the skin. And Thermage is not removing any skin, but it's just tightening through a different mechanism of action through collagen stimulation. The other difference that I want to delineate is there is no downtime with Thermage or Ultherapy, but there is downtime with Ellacor. So Ellacor, you have these like red squares, and you can have bruising and swelling. One of my very good friends, who's my first patient who I ever treated, you can see her YouTube, she had some downtime. There's a lot of downtime with the procedure, but the red squares, or what we call the post-treatment erythema, will resolve within about 1 to 2 weeks after the Ellacor treatment. If it doesn't, we usually use V-beam, which is a little laser. V just stands for vascular. It's a 595 nanometer wavelength laser that we usually use for rosacea or reversing redness or facial vessels, but we use it to erase the little red squares that can be post-Ellacor. And usually when people do have that little redness, we do V-beam and the red squares are gone like within a week. My friend who had the red squares that lasted a little bit longer from her Ellacor, we didn't want to V-beam her right away because I wanted to see how long those red squares lasted. And she also bled a lot more than most patients do because she was on some supplements, and I didn't ask her to stop her supplements because, you know, I feel like supplements are important, but they also thin your blood and can set you up for more redness after Ellacor. But with the V-beam laser, it just goes right away. And we've treated hundreds of patients with amazing results without the red squares being an after effect, never being an issue. The other thing Ellacor is good for, besides lower face rejuvenation and lifting up on the gels, is for a lip lift result and for perioral lip lines, which we used to refer to as smoker's lines, but nobody really smokes anymore. Now we call them Stanley Cup lines. So it's really good for treating those little stubborn lip lines around the mouth. Oh my God, it's so bright. Let me take off my glasses. Ooh, too bright. Another thing that I wanted to bring up that I know you guys are going to ask me about are at-home devices. So at-home devices, there's not a lot of clinical data and studies demonstrating their importance, but I feel like Nuface uses like the electrocurrent to tighten the muscles and to kind of help with lower face laxity. I've had patients really like the response to Nuface. It doesn't last, so I'm more of like the type of person that will want to do treatments that are going to have lasting effects, not just like something that you're going to have to repeat every 24 hours to maintain results. But I feel like Nuface is one of the at-home devices that I've heard good things about. But you have to be careful with other things like LED lights and at-home devices because they can a lot of times cause hyperpigmentation, melasma, brown spots, which we refer to as silver lentigines as well. So you have to be really careful with at-home devices because it can cause discoloration of the skin. So it's super pretty at Fashion, and oh my gosh, it's a beautiful sunny day. It's a little cold, but it's sunny. Okay, this is like the biggest aloe store. And this is where I get into trouble. But I have to remind myself that I am shopping for my friends and family and staff, not for myself. Oh my God, look how cute these sets are. Okay guys, so I'm in line in Aloe, like waiting to get rung up, and it is a zoo the weekend before Christmas. Is probably not the best time to go Christmas shopping, but I had to get it done today. So I wanted to talk about one more treatment option for lower face rejuvenation, and that is Kybella. So Kybella is deoxycholic acid. It's a fat dissolving injectable that's a naturally occurring enzyme that happens in our GI tract, but we harvest it for aesthetics and we inject submental fat to decrease the double chin or submental fat. You can also use it on other areas of the body to decrease adipose or fat, stubborn fatty areas like the abdomen, the middle thighs, back fat, bra fat. But when you use it on the double chin, it helps make the jawline a little bit more chiseled. A lot of people will ask, well, if you're reducing fat there and you're taking away volume, is that going to cause more laxity? And the answer is no, because there's also a collagen stimulating component to it. As the fat is dissolving, it also regulates collagen synthesis, and that's why we get like that swelling that can happen after treatment. So unlike things like liposuction or cool sculpting, Kybella, when it dissolves fat, stimulates an inflammatory response. An inflammatory cascade, which actually makes collagen and can help tighten the skin as well. So Kybella is one of my favorite treatments for not only decreasing a double chin, but kind of rejuvenating the submental area. And it all depends on your skin turgor and facial laxity and what your skin quality and type is, because sometimes debulking that fat using Kybella and melting away the double chin isn't going to be a good thing because it can cause more laxity. But for most patients, they actually not only experience a decrease in fat under the chin, which gives them a more well-defined jawline, but it also stimulates collagen and skin tightening as well. Let's talk about like outdated methods for lower face rejuvenation. I think the old school method of using filler to lift up on lower face laxity is totally out. It's something that we did in the past. It's fallen out of vogue and it looks terrible. So if someone has jowls or lower face laxity, you don't want to lift it up by plumping their face full of filler. You want to tighten the skin on top, and that gives a much better result. Yay, I'm up next. All right, I got my Christmas shopping done. Look at the tree. Oh my gosh, the tree is so beautiful. I brought my kids here and they were like super excited. Okay, now I need to go get some gifts for my parents and some of my friends and a few more of my amazing staff. A question that often comes up too is if you do face yoga or you Gua Sha or you do M-Face, which is basically the M-Sculpt equivalent to electromagnetic energy using to tighten the facial muscles, does that do anything to your Botox or make you burn through your Botox faster? And the answer is, in addition, I think I just saw one of my patients. In addition to muscular contractions in facial anatomy, once you are using those muscles and they're contracting, yes, you can burn through your Botox faster. If you're doing M-Face, which is like an M-Sculpt, which helps lift and helps with muscular contractions to help rejuvenate the lower face and lift up for correction of laxity, it can in theory make you run through your Botox a little bit faster. So in theory, these things can make you metabolize and burn through your Botox faster. But if it's working for you, if you do Gua Sha for lymphatic drainage, if you do face yoga, don't worry about the Botox burning through faster, because maybe those two treatment options are better for you than Botox in the first place. But it's just understanding how these mechanisms of action work, and then it will make sense to you, like what is doing what is giving me the best result, and what is maybe compromising my response to an in-office treatment that I'm having done. To be honest, I'm not a huge M-Face proponent. I love M-Sculpt for growing your glutes and for abdominal contouring and muscular hyperplasia and hypertrophy for your abs and for body sculpting, but for the face, M-Face isn't my favorite because you don't want to contract your facial muscles and create creases and fine lines. There's better ways to rejuvenate the face, I feel like, through stimulation of collagen instead of inducing muscular contractions of your face, because that goes in clear contrast to Botox, which is one of the longest longest lasting, most used anti-aging treatments that we do in office. As far as Gua Sha and face yoga, if that works for you, I don't have an opinion on it to be pro or against it, but I feel like if you do it at home and it works for you, then it's something that's worth doing. Again, be careful though with facial massage, Gua Sha, and lymphatic drainage and manipulation of the face and facial muscles immediately after Botox. Usually you want to spend about 24 hours not messing with your face after Botox, because if you get a Botox treatment and then you Gua Sha and you're moving around your Botox, you can inadvertently affect a muscle that you didn't want to affect, and you can cause like facial asymmetry or a complication or a facial droop. So just be mindful of that. If you're going to have Botox, wait at least 24 hours before you Gua Sha or do your face yoga, and definitely don't do M-Face on the same day. Really, I'm just going to do this content while I can. He's actually helping me take out all my stuff. So since he's helping me with my bags, I can continue this video. So the other thing I wanted to mention is microneedling and PRP, because people always ask about that. So PRP just stands for platelet-rich plasma, and PRF just stands for platelet-rich fibrin. Most can help rejuvenate the skin to a certain extent, but the problem with PRP and PRF is that they have an affinity to be inside the blood vessels, so they're intravascular. So when you do things like PRP or PRF instead of filler for volumizing or for lifting on the lower face, it doesn't usually work. Thank you. It doesn't usually work that well because it has an affinity to be in the blood vessels. It wants to be intravascular. So the minute it gets injected into the face, it goes right into the circulatory system and it gets removed from the areas where you inject. So I'm not a huge fan of PRP or PRF. The caveat is with hair growth and hair restoration, it actually has a lot of data and scientific evidence backing it up for hair restoration and hair growth. But as far as rejuvenation or lower face laxity, it's not my favorite treatment. Oh, to my left. Okay, good. Thanks. Thank you. Thanks for helping me. Thank you. Okay, so the other thing is microneedling. I know people are going to ask about microneedling. Microneedling, like lasers, will help with the texture of the skin maybe there's a little bit of tightening, but I've never seen it, and there's not a lot of clinical data and evidence in randomized controlled trials showing that microneedling does anything for really like lifting. Maybe if you're younger, if you're 20s or 30s, you may do microneedling and see a big difference, but if you're in your 40s or 50s and you have a lot of laxity, microneedling isn't really going to help you much with tightening as much as like a tightening device like Ultherapy or Thermage or Ellacor will. And you know, lasers won't tighten as much as energy-based devices, but they'll do a heck of a lot more than microneedling will. The last thing I wanted to mention is, you know, at-home devices. Just be careful with at-home devices because, you know, they can actually cause more harm than good. Sometimes at-home devices, especially the LED and infrared light, can cause pigmentation, melasma, chloasma, brown spots, solar lentigines, and things that you don't want. Nuface and things like that can give a temporary tightening effect. Thank you. Thank you so much. It gives you a temporary tightening effect. You're the best. Thank you so much. Now I can vlog while you don't see you're the best. So they'll give like a temporary, you know, tightening effect, but I'm more of like a permanent solution person. Like I want to do things that are going to give a permanent tightening and lifting, not something that you have to do every day. And with something like Nuface, I think he's over here. Yeah, thank you. You're the sweetest. Thank you so much. I appreciate you. You want something that's going to be more permanent and not something that you have to do every day. So Nuface, it works, but then after 24 hours, it doesn't have a response anymore and you have to do it again. So I'd rather invest my time, energy, and money in things that are going to have a lasting effect and not just a temporary effect. Again, as a disclaimer and just managing expectations, all these treatments that I am talking about as a cosmetic dermatologist are nowhere close to like a facelift or a neck lift or lower face, deplane facelift. So that is my disclaimer, but it's perfect for people who want to postpone the date to where they need surgery or who don't want surgery at all. But most of these treatments are focusing on the skin envelope, which is actually really, really important because even if you have surgery and you have a lift, nip, tuck, and pull, if your skin quality and texture is poor, it's still going to age you because you can be snatched with no wrinkles at all and have surgery but have brown spots and fine lines and wrinkles and laxity and still look old. So that's the best way to go, is to protect the skin envelope. But again, knowing, you know, my scope of practice, I defer to my plastic surgeon colleagues when there's a little bit more that needs to be done to rejuvenate the lower face.
Hold me close till I get up. Time is barely on our side. I don't wanna waste what's left. The storms we chase are leading us, and love is all we'll ever trust. Yeah, no, I don't wanna waste what's left. And on we'll go, through the wastelands, through the highways, till my shadow turns to sun rays. And on we'll go, through the wastelands, through the highways, and on we'll go.
Thank you so much for hanging out with me today. I had a fun time doing my last minute Christmas shopping with you guys. Thank you for bearing Fashion Island with me, and it was so fun to like vlog and talk about lower face rejuvenation and topics that I love to talk about while I'm getting my Christmas shopping done. But I wanted to say one last thing, and this is just kind of going in a tiered approach to lower face rejuvenation for people who are on a budget or, you know, want to limit their spending or looking for, you know, kind of like prioritizing the things that we can do, starting from like the least aggressive and least expensive to, you know, more invasive and more expensive treatments. So bottom line, things that you can do for free are living a healthy lifestyle, eating clean, maintaining your hydration status, getting enough sleep, which is something I admit I need to work on. Lack of sleep is something that is one of my weaknesses that I need to work on. But just, working out and taking care of yourself and your health, it will slow down the aging process. So lower face laxity, loss of elasticity, volume loss, bone resorption, things like that have been proven to be slowed when you live a healthier lifestyle. So that's something that you can do just for free. At home, Gua Sha, face yoga, lymphatic drainage, if that works for you. If you use like a Nuface device or devices at home that you feel benefit you, that's something that you can incorporate into your day-to-day life that will help maintain a rejuvenated lower face. Using good skincare products, using like neck tight serum, along the jawline and the neck and the décolleté and the lower face area. Or if you use a tretinoin, whatever medical grade skincare products work for you, or even if they're not medical grade, if you choose to get your drugstore, products, whatever you can do is better than nothing. And you don't have to be getting thread lifts and Thermage and Ellacor and all these in a facelift. There's things that you can do that are less expensive and overall just things that you can do for your overall health that will benefit and slow down the aging process of loss of elasticity and the aging process on the lower face. Moving up a grade from, at-home treatments, medical grade skincare, and things of that nature are in-office procedures that are non-surgical. Of course, some facelifts start at, $30,000, $50,000 and go north of $150,000. So these are crazy expensive and not feasible for everyone, nor even if they were, would somebody want to spend that kind of money on, a lower face and neck lift or a deep plane facelift. I'm sure that there's other surgeons in the area, other places in the country that are less expensive, but around here in Orange County and LA, that's how expensive they can be. But even if price isn't an issue, some people don't want to go under general anesthesia and have the health risks that could be involved in surgery. So in-office procedures at a dermatologist's office also have kind of different levels or tiers that you can go to. The lower tier meaning, like a little bit of Botox, like the Nefertiti lift. 20 units of Botox can help rejuvenate the lower face area, or having one syringe of filler that may be $800 to $1,000, but will last 2 to 3 years and will help, kind of in the angle of the jaw lift up on the lower face. Maybe something that is like a lower tiered in-office procedure that will give you a big jump in lower face rejuvenation without having to go into something that's more invasive or more expensive. And then aside from Botox and filler, we have Thermage, which is an energy-based device, which could be done every 5 years. And again, focusing it from the mid-face to the upper neck will help target this area right here with longer lasting effects that will last 5 years. So if a Thermage treatment is, anywhere from $3,000 to maybe $5,000, or you have to be careful if they're cheaper because they're cheaper for a reason. Either they're using a cheap refurbished machine, or they have someone who's less than highly trained, or they're using one tip for multiple people instead of using one tip per person and packing a punch with 900 pulses. They're kind of spreading it out and you get what you pay for, and that's why it's less expensive and that's why you don't see results. So you can use a Thermage treatment every 5 years that will help with lower face rejuvenation, which is a lot less expensive than, a $50,000 facelift. You could do thread lifts, which that price can vary, but, maybe a couple of $1,000s every 2 years or so, which will help give a lower facelift, not a lower facelift result, but an improvement, which may be a little bit more budget friendly and, a non-invasive treatment that we can do in the office. And then there's Ellacor, which is, I think, is a little bit, more expensive, more downtime. Ellacor price ranges can go anywhere from $3,000 to $5,000 to $6,000 per treatment. There's more downtime. It's more of an investment of your time, and money. Again, it's $4,000 to $5,000, not $50,000 to $150,000 like a facelift would be. So it's all relative, but it's a lot more expensive than just doing Gua Sha at home, which is free, but may not get you to the result that you want or need, depending on your age or the amount of aging that has progressed in your craniofacial anatomy. And then taking it one step further from tightening devices and thread lifts, would be surgical. And that's when you would have to see a board certified plastic surgeon I would say, who specializes in face and neck reconstruction and rejuvenation, because there's some plastic surgeons that do a little bit of everything. You don't want the breast specialist or the plastic surgeon who's really good at abdominoplasty to be doing your facelift. You want the facelift guy to be doing your or girl to be doing your facelift or neck lift. So it's hard to find the right surgeon for you, and it's hard to tell from an Instagram or YouTube who's good and who's not. Everyone has their angle, but I may, if you guys are interested in it, kind of tell you what I would be looking for in a plastic surgeon should I have a lower deep plane facelift and neck lift, because I probably will be on that journey in the future, and I will take you along with me through that. But I would be happy to do a video for you on what I would look for in a surgeon and what I will look for in a surgeon when my time comes. Because like I said before, we can do all the lifting and tightening and skin rejuvenation treatments that we have available, but it's not going to touch the results of a deep plane facelift. And at some point, even myself, I'm going to get to a point where, you know, bone's resorbing, fat and muscle is atrophying, and ligaments are falling, and there's only so much I can do with, you know, Thermage and Botox and Ellacor and thread lifts. So just keep that in mind. But that's kind of like the tiered approach that you can go through when evaluating what lower face rejuvenation treatment would be right for you. Again, if you're 20 years old and you're a little bit puffy in the face and you were out the night before, Gua Sha is going to make a huge difference in your lower face. But if you're 75 years old and you are probably a facelift candidate, Gua Sha is not going to give you the result that you want. Even M-Sculpt won't either. M-Face won't either. Filler may not even be enough at that point. But again, there's some women in their 70s and beyond who are just rocking it and who look amazing without ever having surgery and just doing these, you know, minimally invasive or even at home treatments, and they look great. So hopefully we covered everything. If I forgot anything, please leave a comment in the comment section. Please let this be a safe forum for exchange of ideas. And you guys, if you've had experiences, good or bad, with different procedures, or you have different outlooks or opinions, please, this is a safe place. I want this channel to be a safe, honest place that's non-sponsored, that's not infiltrated by marketing and big pharma and companies and, you know, paid sponsorships and all that stuff. I want it to be clean, authentic, and honest, and I want you guys to be able to talk amongst each other and also say, hey, I've done this, or I've gone to this doctor and he or she was great in your area. So I want this to be a safe forum for you guys. And with that, I'm gonna say goodbye. I love you, and I'll see you next week.